So today we are going to do our final health assessment. So we're going to start out by doing the respiratory system. So for that, how do you sit up? Sorry. So we're going to start by just inspecting. We're going to check her for signs of respiratory distress. So we're looking for, heaving in the chest, blue color. You're none of those things. You're not we don't see muscle strain when you're breathing. So no distress. So then we will check for symmetry in the chest. So it should be a 2-to-1. So it should be 2 hands here to 1 hand on the side, which it is. So that's the symmetry. The shape, you're not barrel chested, which is what that also checks for. So that's barrel chested, it really bows out.
Oh, okay.
Then that's often like a COPD because they have extra fluid and air in their lungs.
Oh, interesting.
So they barrel. So then we will, we're going to palpate the anterior chest wall, check for masses, check for tenderness. Let me know if anything hurts or bothers you. No pain anywhere? Okay, good. I don't feel anything. So then we are going to check what's called tactile firmitus. So I'm going to place and have you say 99 for me.
99.
Say again.
99.
Say again.
99.
We get on the side here. Okay.
99. 99.
Okay. So we'll do that in 6 to 8 different places across the front of the chest. We should feel like a slight vibration is all. You don't want to feel anything too much. So then we check for symmetric expansion. So I'm going to have you breathe really deep for me. Okay, just to make sure that one side's not inflating more than the other. Don't eat Doritos.
Very big cat.
So, and then we will check percussion for resonance. So I'm going to kind of move against you here. Okay. Just to make sure we don't hear any really, really high pitch noises. High pitches are bad. It means hollowness. Your lungs shouldn't be hollow. So we'll do that in 10 to 12 different places. And then we will listen across the front of your chest. When we do this will also be 10 to 12, but I'm not going to make you do that because we're not hyperventilating today again. So
Thank you.
You have to take a deep breath for me. Okay. Like I said, that would just be 10 to 12 different locations, but I'm not trying to kill you today. So then we'll move to the back of the chest. I'll kind of have you twist towards that way a little bit. We're just going to follow the same pattern. We're going to watch again, make sure there's no pull from the muscles, there's no blue color, but you're doing all right. We'll again check the symmetry. It should be the 2-to-1 again on the back. Palpate for tenderness, so there's no masses, no soreness. We get a little more space back here to work with. So then we'll again watch for symmetric expansion. So have you breathe for me, real deep. Okay. So then we're going to do the tactile firmitus again. So have you say 99 for me?
99.
Okay.
99. 99. 99. 99. 99.
Okay. So then we will move on and we will do the resonance in 14 to 18 on the back just because there's so much more space to work with. You always want to go across and down so you get the same place on both sides for comparison. So that would be, again, the 14 to 18 on the back. And then we're also going to do 14 to 18 when we listen. So again, have you breathe for me. So that would be in 14 to 18 as well. So then we are going to check for vocal sound tests. So we can do, so what we will do is we will do the bronchophony. So I'm going to listen. I'm going to have you say 99 for me, okay?
Okay. 99, 99, 99, 99.
So for that, I should just hear, which I did. It's a very just muffled, kind of like Charlie Brown teacher sounding.
Okay.
So I know you said something, but not exactly what it is. And then we have another one, which would be egophony. We have them say E, and it turns into like almost an A sound. Or we do the whispered pictoquilliquy, which we have them whisper 1, 2, 3, and it should again just sound like that muffly. Those are the different tests that we do for that. And that's just consolidation.
What are you listening for? What are you listening for?
So it's consolidation, so just make sure that there's no like weird vocal like pockets of air, because they wouldn't conduct the same.
Oh, okay.
So then just advantageous lung sounds. Normals just sounds kind of harsh. It's very loud. Wheezing is high-pitched squeaking. Heard.
I know that sounds like
Wheezing? Yes, you've heard me do it a lot as a child. It's not good. And then bronchi is a low-pitched, heard typically on expiration, typical of bronchitis. Stridor is also high-pitched on inspiration. It's very conclusive with croup. We hear it a lot at work. Croup also is conditioned with a seal barking cough. Kind of disconcerting. Two different kinds of crackles. There's fine crackles, which are soft and high-pitched popping sounds. Doesn't clear with coughing, typical of CHF. And then there's coarse crackles, which are loud, low-pitched, bubbling sounds, typically conductive of pulmonary embolisms, pulmonary edema, or pneumonia. So that is respiratory. We will move on and do a quick bedside neuro exam. So have you spin back flat for me?
lay down.
No,
Just forward.
just turn. So we're gonna start always by checking level of consciousness when you do neuro exams. So you're alert, you know where you are, your eyes open spontaneously. I don't have to like wake you up. You can follow verbal commands. So if I tell you to like raise your eyes or raise your arms, you follow verbal commands. You don't have to do pain response. I don't have to, pinch your cuticles or sternal rub you to wake you up to get you to respond to me. And you're not completely unresponsive, so you get an A out of the AVPU. So you are completely alert. So you
Should I
know.
just get the cat.
No, he's fine. So you are orientation, ANO times 3, which is what you are. You know person, place, and time. You know who you are.
Mm-hmm.
Who are you?
I'm Faith.
Where are you?
I'm at home.
And do you know what day it is?
The 17th, perhaps.
Yes. But you know like what month it is?
Yes.
Yeah. You know what day of the week it is.
It is a Wednesday. Yes.
This is where the night shifts would fail. These two are like, I don't know what day it is either. So I'm gonna have you squeeze my fingers. Okay. Check for symmetry there. Have you raised your legs for me against resistance? Good. And good. And then we're gonna do the superficial and the pain and soft again. Okay. Sharp and dull.
Oh, okay. I think I failed that last time.
You did.
Maybe
But
I'll do better.
you also made me nervous. So just close your eyes for me. Tell me if you feel soft or dull.
Soft.
Okay.
Dull.
Well, dull or sharp, but
Oh,
you know
well,
what I mean.
it's sharp, yes. And soft. Say sharp. Soft. Soft. Sharp. Soft. Sharp.
Good. so you can differentiate between soft and sharp.
Bug.
And then your pupils, we're gonna check them, make sure they are equal and round. Good. We would check reactiveness to light, but we don't have we don't have a light. I would use my phone, but my phone is my recorder. And then make sure we can accommodate here. So we'll have you focus here, and then come in, and you cross and constrict, which is good. And then we would check your reflexes in your knees, which would be the only reflexes we do on a bedside, just for necessity. So now we will move on to the abdomen. So have you lay down for me? Sick, I need your belly. So it's 4 quadrants, upper, lower, both right and left. Simple enough. So we're gonna inspect and make sure there's no. Can I raise up for me just a little bit? Yes. So I just want to make sure that color's good. There's no like abnormal coloring areas, no big red patches or bruising, or you just got freckles. Make sure there's no like herniations, no big masses. So we are going to listen to bowel sounds. So just listen in each quadrant. When you're listening to bowel sounds, you want to go from the right lower to the right upper to the left upper to left lower, because that tracks the large intestine.
Did you hear anything? Yes. I'm not eating much last week. I was curious.
So that's those, and then we are going to listen across the aortic, the renal, the iliac, and the femorals. We're going to listen for brutus, which is just very, very harsh sounds in the vessels. So we'll just listen to those things for any harsh sounds to check for abnormalities in the veins, the arteries there. And then we will, we're going to percuss the abdomen to check for masses and air pockets. So. And sounds will kind of change as we get over some of the organs, and that's normal. It's
Oh yeah, go put that one sounded different.
Yeah, that's your stomach. It's a little hollow, so it sounds a little
It's
higher
empty
pitched.
right now, so.
So the hollow ones sound higher pitched.
Oh, okay.
That's good. So then we are going to check the liver for the liver span. So your liver sits under your ribcage here. So we kind of until it goes a little bit. Okay, see how it's dull? There's not. It's a little more dull.
Oh yeah.
That's your liver. And then it tracks up into here. Sorry. So right about there. So that's your liver.
Oh yeah. I can hear the difference. Cool.
So that's the liver, and then we should not be able to hear the spleen because it should be up under your ribcage. If it's not, it's bad. Let's go over here. So it doesn't really change sounds until like right under the ribcage, which is good. And then we check the kidneys. So for the kidneys, that's when we kind of have to reach under.
You set up or?
Nope. I kind of use you as my weight.
Oh, okay.
You have to kind of pinch the kidney.
Can you feel it?
I can feel Shadows kidneys.
Poor cat.
I've done it more than once to him.
Poor thing.
So none of that was tender when I was working on that, right? Nothing hurt.
No.
Good.
Yeah.
Other than me squeezing your kidney. So then we check the inguinal nodes. So those run like right next to the femoral artery. There's ones that run horizontal, ones that run vertical. Yeah, I got that right. So we'll check in here. Make sure there's no tenderness, no warmth, nothing hurts. No, good. So then we are going to do the diastasis recti, the abdominal muscle separation,
Oh, yeah.
which we know you have. So do a crunch for me. And then we are going to check for kidney tenderness. So for that, I am going to have you sit up again for me. Kind of stays turned like that. So we place our palm over the kidney, and then we hit the palm. That doesn't hurt? No? Okay. So if we were to do that and you had like some kind of kidney disease or kidney inflammation, that becomes increasingly painful because your kidneys sit in the back.
And that would hurt.
Yes. So as you hit it, the jostling makes you feel like you've been stabbed. As far as bowel sounds go, we have hypoactive bowel sounds, which is just very infrequent bowel sounds. It just means you have minimal activity. We can't put it as absent until it's at least 5 minutes per quadrant. So that doesn't often get charted.
Do you have to listen solid 5 minutes? Like
Solid 5 minutes per quadrant.
goodness
So it's
gracious.
full 20
Okay.
minutes to write absent vowel sounds. And if you hear anything at like 4:59, you can't put it as absent because there was something. And then Brobergism, which is essentially the gurgling you hear. If like you have really, really loud like gut noises, you can hear it yourself.
Mhm.
That's what that is.
Okay.
It's like those weird
Yeah.
gurgles that you hear. You should be able to lay back down because the rest is cardio and peripheral vascular. So we'll start with peripheral vascular just because it's in the first page. So we're going to look at the extremities. We're going to look for color. We don't want anything blue. We don't want any weird patches on them. You have a bruise on your shin, but that's beside the point. Check for color, ulceration, swelling, pitting, scars. So you're not swollen, you don't pit when I push on you. We're gonna kind of. There's no pitting. There's no. You're not hot. You're not super cold, which is good. So let's into step 3 there, the temperature. So turgor, we're gonna check your skin elasticity. So we'll pinch and make sure it comes back on its own, which it's supposed to do, which means your like elasticity is there. There's no tenderness, there's no soreness or anything, no sore spots. So then we are going to check the pulses. We check all pulses bilaterally except for carotids because we're not cutting up blood flow to your brain this morning.
Thank you.
Evening. Never happens to me. So we start with the temporals. And then we do the carotids one by one. And then we have the brachials. So let me see your other one. And radials and the wrists. Do the femorals. Could you bend your legs for me so we can see you? I gotta get in here though. So these are in the back of the knee. So popliteals. And then we do the dorsalis pedis. So it's gonna be, if I can get down there, there we are. So it's gonna be between the first and second toe at the top of the foot. right where it starts to arch. Is that one. And then we have the posterior tibial, which is going to be on the outside of the ankle. So those are our pulse points that we check. Just get back up. And then we're going to do the Allen's test for the patency of the ulnar. So I'm going to close off here and here. Your hand kind of goes white. You lose some feeling in it. And then we let go of the ulnar. Make sure you get all your feeling back, your color's coming back. So that's what we did before. We were supposed to access radial arteries to make sure that your ulnar is still good, because if not, you can lose a hand. And then we're going to check calf refill. So let me see your fingers. I'm going to have you kind of keep your fingers bent since you have the same color problem that I do. Alright. So when you pinch the fingernail, it should lose color to white, and then when you release, it should come back within 2 seconds to normal. I don't know why mine do that too, see? When you pull tight, it goes white already on its own. So that is peripheral vascular. And then we are moving on to cardiovascular. So for this one, we are going to look for the substernal notch, which is right at the base of the sternum, or the top of the sternum, at the connection to the clavicles. There's a little divot there. From there, we go to the angle of Louis, which is a dip where the sternum, that top piece of the sternum, and the actual breastbone piece meet. That's right about the second rib, second intercostal. So from there, we can find your second rib and your second intercostal space. So then we're looking for distress, any kind of fatigue, coughs, anything like that could be disturbing you on your chest. No cyanosis, you're not purple or blue. These are very good things. So then we are going to we're going to check your jugulars, make sure you're not pulsing while you're just laying here, so just look straight ahead for me. Good. So there's no pulsing, which is what we want. And then we're going to do the hepatojugular. Let me turn this way a little bit. So what we're going to do is we're going to have you just kind of lay like that. I'm going to press on your liver, and it'll fill your jugular. And then when we let go, it should release. If it doesn't, it's kind of fluid overload. So I'm going to press here. You can watch it start pulsing in your neck. And as we let go, the pulsing quits because the fluid all went back where it's supposed to go. So there's a big vein that goes from your liver. It's the hepatic vein that goes from your liver up in there. So when you push on the liver, it pushes all that up into your neck.
That's so cool.
Yeah, it's fun. So we're gonna do that. So we check to make sure there's no lifting, like there's no excessive heartbeat. So right here in the fifth intercostal, we watch that to make sure there's no jumping, there's no pulling, because that means your heart's working way too hard. And it's not, so that's good. So then we check the apical pulse, which is again in that fifth space. Just make sure there's anything crazy going on. You should feel like a faint. There should be a whole lot. And then we're just gonna use the palm of our hand and just kind of feel over, just to make sure there's no pulsing, no masses within the heart space. Which again we don't, which is good. So then we're gonna listen. Our loudest areas should be S1 and S2. So it should be like up here and down here. Those should be our two main points. And those are your systolic and diastolic
Okay.
pulse numbers. Or blood pressure. Okay. So those are the two. And then we're going to make sure that S1 and our carotid pulses are on the same page. So we're going to listen to that and feel the carotid at the same time. Okay, so those are good because we don't want those out of sync. Because that means something's gone wrong. Because this is pushing up to there. So if this is before that, something is awry.
Oh, okay.
So then we are going to listen to all 5 of the different locations that we listen to. So we've got aortic, the pulmonic, Erb's point, tricuspid, and then the mitral. So we'll start with aortic here. Aortic. And the pulmonic. And then Erb's point is right in the middle. So tricuspid. Okay. So that's those. And then we're going to listen to the carotids. So we're going to listen to them for the Brutus, that harsh abnormal sound. So we listen to those in 3 different places. We're going to listen at the angle of your jaw, in the middle, and then at the base of your neck. So, and then for abnormal heart sounds, there's systolic or diastolic murmurs. So systolic murmurs are going to be heard during S1 or at the S1 point, which is going to be your pulmonic is where you're going to hear S1. That's the tricuspid valves, that's the tricuspid area, so it's going to be that 4th one we listen to. And then S2 is diastolic, which is going to be your aortic, is what you're going to listen to for that. So that should be everything. We did respiratory, we did bedside, we did cardio, we did belly, we did peripheral vascular. So that should be all.
It's over.
It
It's so
is.
much fun.
All right.